Hello, my name is Mark McDavid with Seagrove Rehab Partners. I'm here with Sabrena McCarley from Select Rehab. Say hello, Sabrena.
Hello, everybody.
And we are back once again to start a vlog series, kind of on the reopening process. As you know, surveys are restarting, and we're seeing more and more surveys occur in nursing homes. And with that comes regulatory stuff that we honestly haven't thought about in well over a year. With good reason, right? We've been dealing with the pandemic, and in many of our facilities, this was a life and death type of day-to-day event where you guys went into the trenches and donned your PPE and cared for people who couldn't care for themselves every day. And so some of the regulatory pieces that we normally pay attention to and normally focus on during normal operations of a skilled nursing facility or a nursing home, those things kind of went by the wayside because we were worried about life and death, right? And that's just kind of the facts of the situation. So today we wanted to start this vlog series and touch a little bit on what do we need to remember, right? What do we need to focus on that we haven't focused on potentially for the last year or so? So Sabrena, as you've made your way virtually around the country, and hopefully, knock on wood, we'll be doing some of that actually around the country soon. What are you hearing from clients as it relates to reopening and quality and QAPI and all of those things?
Yeah, so I think now is a great opportunity as we are 14 months into this, and now we really have the opportunity to look at the barriers that we faced with COVID and kind of reflect upon those barriers from the beginning, right? At the beginning, we started seeing changes in behaviors of staff, changes in the behaviors of our patients. We started seeing, the effects of the social isolation, changes in their daily routines, the way we delivered therapy and activities. And we've kind of settled into that routine from the patient's day to day. And that has caused us to really change a lot of our kind of IDT behaviors. And it really was for the health and safety of our patients and patient care being number one. And so now as we're reopening, we really have this opportunity to look at those barriers and say, okay, now we're faced with them again. Now they're going to be coming out of their room. Now we're going to be re-engaging in activities. Now we can get into the therapy gyms. Now we can look at different modes of therapy delivery. Now we're looking at variations with visitation and what does all these activities look like without a mask. So now we've got this opportunity to really come together as an interdisciplinary team and reflect upon what were some of those systems that we had in place before COVID? What kind of fell to the side, wasn't kind of in the forefront during COVID? And what have we learned? And, what do we want to resume? Maybe this is that opportunity where we say, we did it that way because we did it that way for 20 years. But now is that time to bring back and say, all right, let's have a staff meeting. Let's talk about OBRA. Let's talk about the role that absolutely every member of the interdisciplinary team plays in really reducing rehospitalization and maintaining our patients' highest level of function. And then let's look at, okay, where are we at from QAPI? Is our QAPI focus that we had last year, is that really where we need to focus now? Or is this the opportunity to really look at all of our quality measures, to really look at what's been going on in the facility, look at maybe some of the risks that we are really perceiving as we're opening up and say, let's reset our QAPI focus. Let's kind of reset and look at quality, and let's look at patient safety and our outcomes and come together. So this is a great opportunity to really start from scratch and really look at, okay, we have opportunity also to really look at all of our care plans, right? And really reassess all of our patients, and let's be individualized and let's really engage them in ways that we may not have been doing before.
Absolutely. And Sabrena laid out about 27 things that we need to all look at, right? I mean, there's a lot of stuff there. This is not an uncomplicated process that we work in, environment that we work in every day. And so in the coming weeks, we're going to try to pick out a few of those items and bring some more information to you and focus on those items through this vlog series. So we hope you will tune back in the coming weeks, and we'll bring you a little bit more information on various topics. If there are things that maybe we don't touch on that you want to hear about, feel free. Drop something, excuse me, drop something in the comments, and or shoot Sabrina or I a text or email. Many of you have that information. So let us know what you want to hear, and we'll see you next time we show up in your feed. Have a good day.
Bye, everyone.